Mr. Jones is a 19-year-old male who has never seen a dental hygienist before. He always had cleanings by the DDS. Explain to your patient the process of periodontal probing. John, I want to tell you what periodontal probing is. It is a simple and important procedure that helps us assess the health of your gums and the tissues around your teeth. I'll use a small, gentle tool called periodontal probe to measure the depth of the space between your teeth and your gums. This space is called pockets. Healthy pockets usually measure between 1 to 3 millimeters. If the pockets are deeper, it might indicate inflammation or infection, which could be sign of gum disease. Probing is quick and usually does not cause any discomfort. But if you feel any sensitivity, just let me know. This process helps us catch any issues early and keep your gums healthy. Susie Jones is an 8-year-old girl who is here for a 6-month prophy recare. Her mother is in the waiting room. The plaque index is 100% with moderate gingivitis. What oral hygiene instructions are you going to give to Susie? Susie, it is important to keep your teeth clean so your smile stays healthy. I'm going to hand you this mirror so you can see what I noticed. There's a lot of sticky stuff called plaque on your teeth. This can make your gums red and puffy, which isn't good. To fix this, I want you to brush your teeth twice a day, once in the morning and once before bedtime. Make sure you brush your teeth for 2 minutes each time. We can even use a timer to help. Use small, gentle circles to clean all the surfaces of your teeth, especially near the gums. Don't forget to brush your tongue too. I also want you to start flossing every day. Flossing is like a special tool that helps clean between your teeth where your toothbrush cannot reach. If you need help with flossing, you can ask your mom or your dad to show you how. We'll work together to make your teeth and gums super healthy again. Now I'm going to have your mom come in so we can tell her what we talked about and how she can help floss you in flossing and brushing at home. Mr. Brown refuses x-ray every time he comes in for an appointment. His last FMX was 7 years ago, and bite wing was over 3 years ago. He has periodontitis but is low caries risk. Explain to Mr. Brown why he needs check-up x-rays. Mr. Brown, I understand your concerns about x-rays, but they are an important part of keeping your teeth and gums healthy. Even though you don't have high risk for cavities, which is good, you do have periodontitis, which is a serious gum condition that could cause bone loss around your teeth. X-rays help us see what's happening beneath your gums, like bone levels and the extent of any bone loss. Your last full set of x-rays was 7 years ago. The smaller check-up x-rays was 3 years ago. This only showed limited area. With periodontitis, we need to monitor how your bone is holding up to prevent tooth loss and other complications. These x-rays that will be taking will allow us to catch any changes early and adjust to your treatment to keep your mouth healthy. We will be using the lowest radiation dose possible, and the benefits of catching problems early outweighs the risks. Let's work together to make sure your oral health stays on track. Miss Jones is a 25-year-old female who does not want to have fluoride. Discuss the pros and cons of fluoride use. Miss Jones, I understand your concern about fluoride, so let's get over the pros and cons to help you make an informed decision. So, pros of fluoride use. First, fluoride is highly effective at preventing cavities by strengthening the enamel or the outer layer of your teeth, making your tooth more resistant to acid attacks from bacteria and sugars. Next, it helps to repair early signs of tooth decay by remineralizing areas where the enamel has started to weaken. Also, using fluoride can save you money in the long run by reducing the need for more extensive dental treatments like fillings, crowns, and root canals. And finally, fluoride's benefits are supported by decades of research and is recommended by major health organizations like American Dental Association and the World Health Organization. Let's talk about the cons. In rare cases, overexposure to fluoride can lead to dental fluorosis, which usually occurs in children. However, this is not a risk for adults with controlled fluoride use. Next, some people prefer to avoid fluoride due to concerns about potential health effects, even though these concerns are generally not supported by scientific evidence. If you prefer to avoid fluoride, there are other preventive measures we can take, such as using fluoride-free toothpaste and focusing on excellent oral hygiene and diet. If you have specific concerns, I'll be happy to address them. My goal is to help you maintain your oral health in a way that you're comfortable with. Mr. Jones is a 40-year-old male who has been smoking for years, recently 2 packs a day. Discuss possible periodontal complications due to this risk factor. Mr. Jones, smoking is a significant risk factor for your oral health. Let me explain some of the potential complications, especially when it comes to your gums and the tissue supporting your teeth. So first, smoking reduces blood flow in your gums, which means they don't get oxygen and nutrients they need to stay healthy. Unhealthy gums make it easier for bacteria to cause infection and increase your risk of developing gum disease and periodontitis. Know that if you develop gum disease or need any dental procedures, smoking slows down the healing process as it impairs the body's ability to repair tissue and fight infections. And over time, smoking can lead to more severe bone loss around the teeth. This bone supports your teeth, and losing it can cause teeth to become loose or even fall out. Smoking reduces treatment effectiveness. For example, procedures like deep cleanings and surgeries may not work as well because your body's healing response is compromised. Also, smoking can mask early signs of gum disease like bleeding gums, making it harder to catch the condition before it becomes serious. Quitting or even reducing the amount you smoke can greatly benefit your oral health. We can discuss some strategies to help you if you are interested. Taking steps now can help protect your teeth and gums in the long run. Miss Jones is a 30-year-old female who presents with herpes on her upper lip. Miss Jones is a 30-year-old female who presents with herpes on her upper lip. Explain what you need to do and why. Miss Jones, I don't know if you've noticed this, but I see that you have a cold sore on your upper lip, which could be caused by virus. Cold sores are contagious, and the virus can be easily spread through contact. Because of this, we'll need to postpone any non-emergency dental treatments today. This is to protect both you and others from the risk of spreading the virus. Performing dental procedures could also irritate the sore, causing it to worsen or take longer to heal. In the meantime, I recommend that you avoid touching the sore and you wash your hands frequently and apply over-the-counter antiviral cream to help it heal faster. Once the sore is fully healed, we can safely proceed with your dental treatment. If you have any questions or need advice on managing the cold sore, feel free to ask. We're here to help you through this and make sure you're comfortable. Miss Brown is a 58-year-old female whose assessments show evidence of moderate horizontal bone loss on the x-rays, 3 to 7 millimeter pockets, and generalized bleeding on probing. Explain periodontal disease and what treatment needs to happen. Mrs. Brown, based on your assessment, it appears that you have periodontal disease, also known as gum disease. This is a chronic infection that affects the gums and the bone supporting your teeth. Here's what's happening. Here, on your x-ray, it shows that there's some loss of bone around your teeth. This is concerning because bone is what holds your teeth in place. Without proper treatment, this can progress, leading to wobbly teeth or even tooth loss. The pockets or space between your teeth and your gums are deeper than they should be. Healthy pockets are usually 1 to 3 millimeters, but your range is 3 to 7 millimeters. Deep pockets can trap bacteria, which can worsen the infection. The bleeding you're experiencing during probing is a sign of inflammation and infection in your gums, which is common symptoms of periodontal disease. Let's plan your treatment. Deep cleaning is the first step in treating periodontal disease. We'll clean deep below the gum line to remove the plaque and tartar buildup that's caused the infection. We'll also smoothen the root surfaces to help your gums reattach to your teeth. In some cases, we might need to use antibiotics to help control the infection and reduce bacteria in your mouth. After the deep cleaning, it's important to have regular follow-up visits to monitor your progress and make sure the disease is under control. We might also need to do additional cleanings to keep the pockets from deepening. At home, maintaining excellent oral hygiene is crucial. This includes brushing twice a day, flossing daily, and possibly using antimicrobial mouth rinse to keep bacteria levels low. By adding this now, we can prevent further damage and protect your oral health. Let's work together to manage this condition and keep your teeth and gums as healthy as possible. Mr. Jones is a 50-year-old male patient who takes multiple medications and complains of xerostomia but no sensitivity. He does show some incipient caries. In addition to oral hygiene instruction, what recommendations will you make to Mr. Jones? So again, xerostomia, incipient caries. What additional oral hygiene instructions will you give? Mr. Jones, the dry mouth that you're experiencing can be a side effect of medications you're taking. You also have some early signs of tooth decay. Here are a few recommendations I'd like to make in addition to managing your good oral hygiene. First, drink plenty of water throughout the day to help keep your mouth moist. Sipping water frequently can help counteract the dryness. Next, there are over-the-counter saliva substitutes or oral moisturizers that can help alleviate dry mouth. These come in sprays, gels, and lozenges, and they can help your mouth more to make your mouth more comfortable. Try chewing sugar-free gum, especially those containing xylitol. This can stimulate saliva flow, which is beneficial in reducing dryness and preventing cavities. Limit or avoid caffeine and alcohol, as they can dry out your mouth further. Limit sugar and acidic foods, as this can increase risk for tooth decay, especially when saliva is reduced. Consider using fluoride toothpaste and possibly a fluoride mouth rinse that will help strengthen your teeth and protect against decay. Just make sure your fluoride rinse does not have alcohol, as alcohol is drying. It is important to keep up with regular dental visit so we can monitor with your oral health and address any issues early. By following these recommendations, we can help manage your dry mouth and reduce risk for further tooth decay. Let me know if you have any questions or if there's anything you need help with. Mr. Brown is 28 years old, male, who takes medicines for anxiety and depression, and indicated he is very nervous about the prophy appointment today. What can you do for or say to Mr. Brown to reassure him? Mr. Brown, I completely understand that dental visits can be stressful. It is important to me that you feel as comfortable as possible today. Let's try a couple of things to help you relax. First, we will take things at your pace. Know that you are in control, so if at any point during the appointment you feel uncomfortable or you need a break, just let me know. I will explain what I'm going to do before I do it, so there are no surprises. We can try some deep breathing exercise. Taking slow, deep breaths can really help calm the nerves. If you find it helpful, you can listen to your favorite music or a podcast during the procedure. Some patients find that this helps take their mind off things. I will do my best to make sure you're comfortable as possible in the chair. If there's anything specific that helps you relax, please let me know. Remember, you are not alone in feeling this way, and we're here to support you. Let's work together to make this visit easy and stress-free as possible. Mrs. Reed has brought her 6-year-old daughter Chloe in for a checkup. The doctor has recommended sealants on some of the back teeth and fluoride treatment. Mrs. Reed is okay with the sealant but is skeptical about the benefits of fluoride treatment. Explain the fluoride treatment and benefits to Mrs. Reed. Mrs. Reed, I understand your concern about the fluoride. So let me explain how it works and why is it beneficial for Chloe. Fluoride treatment involves applying fluoride gel or varnish to Chloe's teeth. It is a quick, simple procedure that we typically do at the end of the dental visit. The fluoride helps to strengthen the enamel on her teeth. Fluoride helps remineralize and strengthen the tooth enamel, making it more resistant to decay. This is especially important for children like Chloe who are at the risk of cavities. By strengthening the enamel, fluoride helps to prevent new cavities from forming and can even help to stop small areas of decay from getting worse. Fluoride treatments are safe and they have been used for decades to help protect children's teeth. The amount used is carefully controlled to ensure it's effective but not excessive. While sealants provide protecting coat on the chewing surface of the back teeth, fluoride treatments helps to protect all the surfaces of the teeth from decay. offering an additional layer of protection. Investing a fluoride treatment now can help reduce the risk of cavities and more extensive dental work in the future, which can be more costly and invasive. If you have any specific concerns about fluoride or if you'd like more information, I'm here to answer any questions that you might have. The goal is to provide Chloe with the best possible care and to keep her teeth healthy and strong. Mrs. Jones, a client who has not been to the office for 2 years. Good morning, Mrs. Jones. I haven't seen you in a while. How have you been? Not well. My husband was diagnosed with pancreatic cancer, and I have been so busy taking care of him. It's been 2 years since I've been here. I need cleaning, but I also have some pain in my back teeth and my jaw hurts. I'm sorry to hear about your husband's diagnosis. That must have been incredibly challenging for you. First, let's make sure we address the pain and discomfort that you're experiencing. We'll start with a thorough examination of your teeth and jaws to identify the issues. It is important we understand what might be causing the pain in your back teeth and your jaws. After that, we'll proceed with cleaning to remove any plaque and tartar that might have built up over the past 2 years. Given that it's been a while since your last visit, it is important to get your oral health back on track. If you have any concerns or if there's anything specific that's been bothering you, please do let me know. We're here to help you through this, and we'll work together to get you feeling better. Mr. Vasquez, a client who is taking multiple medications and complains of xerostomia. Hygienist. Mr. Vasquez, I just looked at your x-ray and I see few suspicious areas. Are you having any pain or sensitivity? Well, now that you mentioned it, I forgot to tell you, I notice my teeth have been sensitive lately, but only sometimes. Mr. Vasquez, thank you for letting me know about the sensitivity. It is important we address this, especially since you've noticed it recently. Given that you're taking multiple medications and have xerostomia, sensitivity can become a common issue, as reduced salivary flow can lead to dryness and increased sensitivity. Here's what we'll do. I will perform a thorough examination of your teeth to pinpoint the cause of sensitivity. This will help us understand if it's related to your medication, any recent changes, or possibly issues indicated on the x-rays. We'll carefully review the suspicious areas on the x-ray to determine if there are any underlying issues that need attention. This could include cavities, enamel erosion, and other conditions. Based on our findings, we will discuss appropriate treatments. This might include fluoride treatment to help with the sensitivity, changes to your oral care routine, or specific products designed to reduce sensitivity. We'll also talk about managing xerostomia or dry mouth, as it can contribute to sensitivity. There are various products and strategies that we can use to help alleviate your dry mouth, which might also help with the sensitivity. Our goal is to address these concerns comprehensively and ensure your comfort with your oral health. If you have any questions or specific concerns, please let me know so we can make sure everything is taken care of. Mrs. Reed, who just brought her 6-year-old daughter Chloe for a checkup. Mrs. Reed, the dentist just completed his exam. just completed the exam on Chloe. She's recommending sealants on some of her back teeth and fluoride treatment. Oh, I don't know. I just don't like using fluoride because it's linked to neurological problems. And aren't sealants made of plastic? I don't think I like that either. Mrs. Reed, I understand your concern about the fluoride and sealants. Let me provide some information that might help you clarify these recommendations. As of fluoride treatment, fluoride has been extensively studied and is recommended by many major health organizations, including American Dental Association and Centers for Disease Control and Prevention. It's been proven to strengthen the enamel and help prevent cavities, which is especially important for children. The amount of fluoride used in the treatment is very controlled and safe. The benefits of preventing tooth decay far outweighs the minimal risks. There are no credible evidence linked to fluoride use in dental treatments to neurologic problems. And as for sealants, they are used to protect chewing surface of the back teeth from cavities. They act as a barrier to keep the food and bacteria out of the grooves of the teeth, where the cavities often form. The materials used in sealants are tested for safety and are designed to be durable and effective. They're a preventive measure that has been shown to significantly reduce the risk of caries in children. If you're still unsure, I'm happy to provide more detailed information or discuss alternative options with you. Our goal is to ensure Chloe's teeth stays healthy and provide you with all the information you need to make the best decision for her care. Mr. Chen, who refuses radiograph often, it's been 7 years since the FMX and 3 years since the last bite wing radiograph. His caries risk is low, but he has periodontitis. Okay, Mr. Chen, thank you for your update on your health history. It looks like you are due for your cleaning. A full set of x-rays and an exam today. Can we get started? I really don't want x-rays today. I understand your hesitation about taking x-rays, Mr. Chen, and I appreciate your honesty. Let me explain why they are important for your care today. Even though your caries risk is low, you have periodontitis, which is a condition that affects the tissue supporting your teeth. X-rays are crucial for a few reasons. First, it allows us to see the bone levels around your teeth and check for any changes or loss of bones that might be associated with periodontitis. This helps us understand the extent of the disease and tailor the treatment effectively. Next, they help us identify any potential issues that are not visible during clinical exam, such as areas of bone loss or problem between teeth. This is important for comprehensive care and preventing further complications. Since it's been a while since you had your last full set of x-rays, having updated images helps us track the progression of your periodontitis and evaluate the effectiveness of your current treatment. We use the lowest possible radiation dose to ensure your safety, and the information we gain is essential for providing you with the best care. If you have any questions, concerns, or would like to discuss this further, I am here to answer your questions and address any worries you might have. Your health and your comfort are our top priorities. Mr. Lemon, who has exhibited dental anxiety in the past. Hygienist. Mr. Lemon, thank you for coming in today. Let's review your medical history. Last time you were taking 10 milligrams of lisinopril daily for your high blood pressure. 20 milligrams Lipitor daily for your cholesterol, and 20 milligrams Lexapro daily for your depression. Has anything changed in your medication? Mr. Limon. Yes, I started taking new medication for anxiety, but I can't remember the name. Thank you for letting me know, Mr. Limon. It is important for us to have most current information about all your medications, especially since they can affect your oral health and treatment. If you are unsure of your medication name, you might check with a pharmacist or your healthcare provider for the exact name. In the meantime, we can proceed with your appointment, and we'll take extra care to make sure that you're comfortable throughout the process. Also, if there's any specific concerns or any way we can help manage your anxiety during today's visit, please let me know. We are here to make sure you feel as relaxed and at ease as possible.